Hello, everybody, and welcome to my presentation on deep oscillation therapy for treatment of deltoid ligament sprains. My name is Jake Nardoni, and I'm a first-year graduate athletic training student at the University of Texas at Arlington. A little bit of background going into our presentation here. Deltoid ligament sprains account for a very small percentage of athletic exposure injuries, but regardless, they do cause significant time loss and disability to the athlete. Deep oscillation therapy is a newer modality that has been out, and it uses repetitive electrostatic oscillations to improve pain and swelling. It's also been seen to have noticeable differences in reduction in edema, ecchymosis, inflammation, and pain after a 6-week treatment plan. So a little bit about our patient. Our patient is a 20-year-old collegiate men's soccer player who was tackled from behind, which forced his right ankle into eversion. During our on-field assessment, the only positive test that occurred was the Collegiate test, and the athlete was able to walk off the field with mild pain. He was later sent for an MRI, and the diagnosis came back of mild anterior talofibular ligament sprain and minimal deep deltoid edema, indicating a low-grade sprain without rupture. For him, we used our normal treatment that we would use, where we started with for our treatment. We began with infrared laser and a compression wrap. Over the next 2 weeks, the athlete received a cocktail of different modalities and treatments to help battle his inflammation and swelling he was having, one of those being the deep oscillation therapy. And 2 weeks after that, the patient began rehab exercises, and deep oscillation therapy was used often for pain relief. The outcomes from this treatment were that he had a decrease of swelling, edema, and pain after about a 3-week period. And with that reduction in surrounding irritants, it helped restore his range of motion and strength. From a literature standpoint, there is no unanimous decision on if deep oscillation therapy is good or should not be used at all. From a statistical standpoint, there's not enough evidence to fully support the integration of deep oscillation therapy, but from a patient satisfactory position, there is tons of evidence showing its usage. One major difference between deep oscillation therapy and other electrostimulation devices is that this modality does not contract the musculature like normal device would, and is more gentle. Therefore, it's not really contraindicated to be used in the immediate acute phase of healing. The bottom line about this is that deep oscillation therapy is a new modality that requires more time to fully understand. While much is still to be learned, patient outcomes are positively affected by its integration into treatment for acute injury.